You're listening to an Airwave Media Podcast.
Welcome to Unbiased Science,
where we bring scientific method to the madness.
We're your hosts, Dr. Steier
and Dr. Sarah Scheinman.
So today's episode, we're so excited. We have a very special guest who I'll introduce in just one moment. But the topic is something we get inundated with questions constantly about the brain. And there's a lot of misinformation about the brain, ways that we could improve brain health. So we've got two neuroscientists on the pod. I feel like I'm third wheeling today, but we're gonna get into it. So without further ado, I'd love to introduce our special guest. Let me pull up this incredibly impressive bio here. Dr. Ayesha Sherzai. So Dr. Sherzai is a neurologist and co-director of the Alzheimer's prevention program at Loma Linda University, where she leads the lifestyle program for the prevention of neurological diseases. No big deal. She completed a dual training in preventative medicine and neurology at Loma Linda University and a fellowship in vascular neurology and epidemiology at Columbia University. She's also a trained plant-based culinary artist, which I think is really fascinating. I want to hear more about that. So Ayesha co-hosts Your Brain On podcast with her husband, Dr. Dean Sherzai. It's a podcast about the neuroscience of everything, life's everyday experiences, explained through a neuroscientific lens with science-based stories, interviews, anecdotes, and brain health facts. And I was so honored. I was just a guest on that podcast. We were talking about Your Brain On Misinformation. Ayesha, thank you so much for joining us today and for imparting your wisdom with us.
Oh my goodness, I don't know what to do with all that positive language. This is incredible. Thank you so much for having me, and it was such a pleasure to have you on the podcast. Jess, you're amazing. Both of you are doing such important work, and I am so honored to be a part of this journey with you.
So can I share, this is going to be maybe too dark. You know, we Jews, we have a dark sense of humor, right? That's just how we cope with life, I think. And so I just want to share.
We do too. It's an immigrant thing. So we do too.
It's an immigrant thing, right? It's just a coping strategy. So just very briefly, I'll start off with some dark levity, maybe. So my background, Ashkenazi Jewish, my family, you know, we've had our host of chronic physical illnesses, and my husband comes from a white Anglo-Saxon Protestant, totally different background. They're like all American, been in America for how many generations. And so we joke, again, dark humor, so please don't hate me for this, that I'm just like in a few years, I'll be so physically decrepit, you know, the cancer, the heart disease that runs in my family. Like at some point, I'm just going to be a shriveled up body with a head that like complains and talks about public health, and that he'll live to 150, but will have every cognitive issue because not a laughing matter, but he does have dementia runs in the family. I believe, is there something called Pick's disease? Is that a form of, form of dementia? Is that right?
It is a form of dementia. Yes, yeah. It's an inherited, or it has a very strong genetic underpinning, and it is a type of a frontotemporal lobe dementia where the personality and behavior gets affected. Yeah, it's pretty scary.
Oh, well, there you go. So that's now in my family's gene pool. But anyway, I don't know. Sorry if that was too dark. But yeah, so I am very interested in this topic for a variety of reasons.
Nothing's too dark for Unbiased Science.
No. And Sarah, so I was just telling Ayesha before we hit record that Sarah, as you all know, is not on social media. So she doesn't see a lot of the unfortunate misinformation that circulates. And I don't know, Ayesha, if you've noticed, there's been this exponential increase when it comes to things like Alzheimer's and dementia in particular. I don't know if maybe I'm just more aware of it now that I co-host with Sarah, but have you noticed that?
No wonder Sarah's just glowing. You know, her skin is glowing. And you and I are kind of looking like curmudgeons. We're like so negative and fighting people all the time. I'm kidding.
I'm just like, I'm feeling good. I'm going to go to the research lab later, do some science. Like, all right.
Yeah, no, it's the numbers look pretty bad, actually. It's just awful. And, you know, this is coming from someone who has had a privilege of taking care of family members with Alzheimer's disease and other types of dementia. And I say that as a privilege because, as I was chatting with you two earlier, it changes you as a person, right? Like your priorities are set very early in life of what's important and what's not. And we, both Dean and I, we each had two grandparents who were incredible human beings. And then slowly and gradually we saw dementia set in. And these people who were surgeons and went to incredible schools and did amazing things around the world couldn't remember the names of their grandchildren. You know, they didn't know how to eat or they didn't know how to go to the bathroom. And it's just such a devastating thing to see. So the numbers look pretty bad. There are a lot of people who are, fighting this disease, dementia in general. And, when we say dementia, it's an umbrella term, and there are multiple different types of dementias. There's Alzheimer's disease, there's frontotemporal lobe dementia, there's Lewy body dementia, vascular dementia, other dementias related to movement disorders like Parkinson's and Huntington's. And then there's mixed dementia, which is like a compilation of different neuropathological changes in the brain. Sometimes dementia and Alzheimer's disease are used synonymously because about, 70 to 80% of all dementias are Alzheimer's disease. And, when you see more of a condition, then, people just go wild with the hypotheses and their thoughts about why this is happening. And the sad thing is, we've been trying to understand this disease for decades now, and we've not really done a really good job. We thought that we would have a good handle on it and we would have treatments by now. We do, but it's not good enough. And it's just this horrible, horrible disease to witness and to deal with. And yeah, the misinformation is just rampant. And I guess that's why we're here to talk about it today.
Well, and it also kind of makes sense why there's so much misinformation out there, because people are scared. I mean, this is a scary disease. It's a scary condition. And the science behind it is it's not where it should be. Like you said, we've known about Alzheimer's disease for over 100 years now. And the treatments that exist are palliative at best. I mean, they can slow the progression, but we don't even know the root cause. Like we in the scientific community, from a basic science standpoint, we don't even know what causes it. So how are you going to treat something if you don't even know what causes it?
Exactly. Yeah. And we're just kind of like moving around with theories. And as scientists, we're okay with that, right? We're okay with the unknown and with things not progressing. And, the most beautiful humility is that of science, where we are comfortable to say, you know what, I don't know. But unfortunately, people don't accept that. And we always want to live in certainty. And it's such a vulnerable population, people who are going through this journey, and especially their family members taking care of them. And they're very, very amenable to pseudoscience and misinformation and false hope. And as a neurologist who works in the clinic and in the hospital, I see that every day, and I absolutely hate it.
Well, and Ayesha, I think you make a really important point here, like, especially for those who've seen it firsthand or, who have risk factors and are concerned about this. We're not blaming those people, right? Because it's understandable that they would want there to be some, a fix or a preventative or some way. Exactly. So again, I always love to give that disclaimer. This is not judgment. If you have heard something and you have fallen prey to some misinformation, and it's often presented in such a convincing manner using very hyper technical language, very absolute language, big promises. So let's get into it. Sarah, I don't know. We compiled a list. We looked at some questions, some heard from the herd, questions that we gathered from our listeners. Can you take a list at what we compiled, and maybe where should we dig in? Where do you want to start the conversation?
Oh my goodness. Well, I mean, we were talking about misinformation misinformation regarding Alzheimer's disease, and I feel and related dementias. I feel like a lot of what we hear regarding that is this the idea of boosting your brain power with supplements. And I personally, like, whenever I tell someone what I do for a living, that I'm an Alzheimer's disease researcher, inevitably they come at me with something that they've heard, blueberries, curcumin, lion's mane. Really, I'm always hearing new ones, and it kind of throws me when I hear this. I because, like I said, I'm not on social media, so like when I hear it. But here's the thing, though. I always take it upon myself to look into them, because I feel like people have heard them. They must be based on something. And just because I haven't heard of something like that just doesn't mean I'm just going to dismiss it offhand. I mean, it's that scientific humility that you were talking about, Ayesha, right? I'm always willing to look into things, but I think maybe we should start there. I mean, from my standpoint as a basic scientist, like, I have not come across anything with regards to the literature and in supplements that has convinced me that this is something that neurologists or clinicians should be recommending to their patients. I mean, what do you think?
Yeah, no, that's such a great question. And we could probably spend days talking about this, because it's such an extensive topic. So the idea that something that we eat impacts our brain health has been the subject of intrigue and misinformation for decades. And as is for other areas in health as well, but especially for a brain, eating something or using a supplement or a nootropic that would enhance your memory is a dream. There are movies about it. Do you guys remember the movie Limitless, where the guy takes a blue pill and then suddenly he can do everything? So in that quest for the limitless pill, everybody is trying to find out, concentrated forms of anti-inflammatories and antioxidants to fight off inflammation, which is such a vague terminology in neuroscience.
Good God.
There is data now that shows us that nutrition plays a part. It is one of the elements among many different things that impacts our brain health. When you look at the data, back in the 1970s, 60s and 70s, the idea that a vitamin could impact brain health or cognition actually started, where they did some studies on populations to look at the impact of, for example, vitamin E and brain health, or vitamin C and brain health and memory problems. And obviously it didn't really give us enough of a signal or a delta, and it just kind of died down. And then since then, scientists have been looking at population patterns and dietary patterns, whether it's the Mediterranean diet or the MIND diet or the DASH diet. And we have these different dietary patterns that essentially is a scoring system, where when you eat certain foods, you get a higher score, and when you eat other types of foods, you get a lower score. And the adherence to these dietary patterns impacts our cardiovascular system. And now we know, Sarah, you probably know this as well, that there's a lot of overlap between cardiovascular health and brain health as well. Yeah. And there's some, vascular hypotheses in Alzheimer's disease as well. So we know that things like saturated fats, consumption of too much saturated fats can increase the risk for Alzheimer's disease. And when we say these statements, there's no causation. There's like strong correlations and pattern recognitions in epidemiology. The concept of epigenetics starts kicking in, which means that whatever you do in your life, it essentially kind of changes your risk factors for manifestation of any underlying condition that you may carry, right?
So epigenetics is a huge focus of my research currently. Actually, the epigenetics of Alzheimer's disease, that's what I research.
Oh, that is amazing. So you know this better than anybody else. And, so that's what we know as nutrition is concerned. The one dietary pattern that stands out that was studied by the Rush University, where you live, Sarah, in Chicago, the Rush Memory and Aging Project. They looked at dietary patterns of individuals for decades and followed them along. And these were not small populations. There were tens of thousands of people followed for, say, a decade or two. And they found out that people who adhere to the MIND diet, they have about a 53% reduction in the risk of Alzheimer's disease. So it prevents Alzheimer's disease. And when people are in the stage of Alzheimer's disease, it slows down the progression to a certain extent as well. That's all we know. Beyond that, as far as specific foods are concerned, like blueberries, There were some studies that were not that big, but they did show that when people consume blueberries, they have better neuropsychological scores, but that was in such a small population that we don't really make a big deal about that. So yeah, blueberries are good, but they're not the magical pill, And it's important for people to know that Alzheimer's disease is not a type of disease that starts all of a sudden. We know that it actually takes about 10 to 30 years for the first neuropathological changes to show themselves in this, for it to get to a point where there's no point of return, and then the disease manifests. The length actually matters too.
I love what you're saying. And just the blueberries, this is something that I don't know who's putting it. Big Blueberry is really putting in the work because this is something I can't tell you. How, they have amazing PR. I looked at a few studies where I guess they were isolating the compound in blueberries that's thought to have this effect. And the studies that I saw were really preclinical studies. So we're dealing with mice and rats, and we're dealing with such a high exposure to this compound. So I always say, how we say the dose makes the poison, the dose also makes the benefit, right? So it's like, all right, how many blueberries are we eating to see this effect?
And like a large focus of my graduate work was I did work on several of these preclinical studies. I'm not with blueberries, but with other with angiotensin receptor blockers and also DHA. So these and I've worked on these like preclinical studies, and there are so many different things that go into the effects that you see. I mean, dose, route of administration, something called pharmacokinetics, which is the way that the drug is processed by your body and the rate at which it's processed by your body. And all of these things go into the effects that can be seen. And when you're looking at something like this in a human population, I mean, I don't work with humans. I work in some ways, my job is a lot easier than like Jess's, for example, because like I get to control and predict what's happening at the lab bench. I mean, mice are a lot easier there are so many fewer factors that go into looking to working in a model like that. But when you're working with humans, it's just there are so many different factors to consider. It's really hard to draw a causative link.
Absolutely. Like you said, we don't eat one food at a time. We eat multiple different foods, and it's the synergy between these foods that matters. It's also the time, it's time dependent. So how long do you expose yourself to certain foods and food products matters as well. Now, just to reiterate what you said, it's complex, it's complicated. We don't have clean data. We certainly don't have, definite data, but we do have some signals that we go by. And with other nootropics that you mentioned earlier, with things like lion's mane's mushroom, right? People are just really like obsessively, investing in that, but there's really no evidence. There's one paper that shows 30 people eating a ton of lion's mane, by the way, which is super expensive. And it didn't really change anything clinically. One of the other things that we see, Sarah, you probably have seen this in your models of work with Alzheimer's disease. There may be some statistical significance in, changes in neuropsychological testing, but that doesn't really equate to clinical significance. Right. So if somebody is losing their keys, right? And if they are dependent on their loved one for their activities of daily living, which is a scoring system, right? We see, can you bathe? Can you groom yourself? Can you clean yourself? Can you eat your own food? Can you take your own medication? And then independent activities of daily living are driving, taking care of household items, managing your food, et cetera, et cetera. Does it change that? Like if you're losing things, are you suddenly going to be able to find it anymore? No, you don't.
Right.
So, statistical significance doesn't necessarily equate to clinical significance. The sad thing is, coming back to the human part of it, because I work with humans, and that can be pretty depressing, is people get so invested in these findings. And there are a lot of charlatans out there who are peddling this information to the population where they say, oh, this worked, but they never say that it worked in mice or in a petri dish. And they equate that to human data. And then they charge them thousands and thousands of dollars based on just false hope. That's borderline criminal. When you play with people's hopes and you give them false information like that, that's bad. Dean and I we had a sign in the clinics. We worked in the same clinic. He would be on the one end of the clinic and I'd be in the other with residents and other physicians. We used to call it the plastic bag sign. So plastic bag sign was someone coming in with like a huge plastic bag full of supplements. And now my job would be to kind of go through them and say, nope, 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 nope. Yes, maybe take a multivitamin, but nope, nope, nope. And they would be spending like subscriptions of like, like $150, $200 a month on just trash.
Very expensive urine.
Yeah. And then there are people who just send these protocols for Alzheimer's disease, and they use the word reversal, which there's none of. So I'm really glad we're talking about this because the misinformation in this field is just wild.
Can I ask you, I have a question for you as a clinician, Ayesha. So, obviously, and as we're all discussing, you have a very unique perspective. You're working with these people, these individuals who really are deeply impacted by this. Is there ever a time, let's say, a more severe case, or I don't know, where someone who has the means to afford and access these, I know we're using the word nootropics. I don't even know. So we're just talking about anything that people, like a supplement or something that people take to try to impact their brain health. Is that essentially what a nootropic is? Or I don't know.
So nootropic are essentially food products or, derivative of a food product that has been studied to a certain extent, not necessarily effective for brain health.
Got it. Okay. So is there ever a time where you see a person, who's really struggling and they're taking these things where you're like, okay, it's likely not having, as you said, any clinical impact, but maybe it's providing some solace or something? I don't know. Like, is there ever a time where you sort of not encourage? I'm just curious. And I know that there's some controversy here. And even, I've said some of these things sometimes where it's like, I don't know. I try to look at it's not benefiting. And if it's being sold by a charlatan as a cure or as a replacement for actual clinical treatment, that's a big no-no. But if it's somehow like providing some solace, is that okay, assuming no like drug interactions?
You mean like placebo effect?
Kind of, yeah. I mean, I wonder, and even if we don't even see a placebo, I guess placebo effect, but not where it's having necessarily like a clinically beneficial impact on brain health, but it's just like the act of taking it is somehow like it empowers the person to feel like they're doing. I don't know. It feels a little like a gray area to me.
Yeah.
What do you think?
No, that is such a great question. That is a very good question. And when someone comes to you as a patient, right, they are in their most vulnerable state of existence where they rely on you and they essentially bring all of their hopes to you and say, help me. And you have a massive responsibility to take care of them. And they become like your family member and you become really, really protective of them.
And Sarah, I hope you're okay. I know it's maybe an unusual question, but like you and I know Ayesha's back. I was just going to say, Sarah and I, we deal with data. And so, it's easy for us to say, okay, this is or is not like, no, there's no evidence for this, but you're there looking the patient in the face. So I'm curious and sorry, you're
all right. Like we're not clinicians. I mean, that's why we talk to clinicians. We bring clinicians onto the show because we're scientists.
Yeah,
very
absolutely. No, absolutely. So I take it upon myself to be very, very honest with them to the point where it hurts me as well. And there are situations where people have no hope whatsoever. They're in the midst of this horrible disease. They're in the medium or to advanced stages. And they come and say, well, what if I do this? Right? It's okay if there's no evidence. But what if I do this? Obviously, their emotional health and their psychology is incredibly important for me. And I deal with a lot of patients. So it's not an individual disease. Mm-hmm. It's like a family and a community disease because usually the caregivers and the loved ones are the one that deal with all of the memory problems, the behavioral problems. And I usually am very honest and I tell them that, whatever supplement or nootropic that they want to take has no evidence. There's no evidence supporting it whatsoever. And I offer other things. I offer cognitive behavioral therapy. I offer caregiver support, things that we know are going to work. So sometimes even at the cost of sounding harsh, I'm usually very, very honest with them. And if it gives them solace, I tell them, well, you're doing something that is really not backed by any evidence. Obviously, at the end of the day, you're the one who's going to make decisions. But what if you do this instead? For example, music therapy or art therapy. We do a lot of music therapy with our patients. We send them to, caregivers who actually starts painting with them, things of that nature. And I take my time to show them the MRI and the science of it, which usually takes more than half an hour. And that's why it's really difficult to work in a clinical setting. When you have such a short amount of time, you don't have time to do everything. But most of my community work is focused on that, to teach people that it's okay. Don't worry. And that we love you and we accept you, even if you have memory problems. You're not defined by how much you can remember. You're way more than that. And, don't rely on anything that's not based on science. There are other ways to find joy and feel good about yourself and protect yourself.
Can we clone you, Ayesha? What a beautiful, empathetic, but also evidence-based approach. That's really incredible. So you mentioned music. Sarah, do you want to bring us in? I know there was another question we received.
Oh yeah, this is a fun one. I think it's called the Mozart effect, and I have no idea where this particular myth came into being, but it's that listening to classical music somehow makes you smarter or protects your brain in some way. And I love classical music. I mean, I listen to classical music while I work or when I'm writing or something, but that's not because I think it's going to make me smarter. I just find it enjoyable to listen to, and I enjoy going to the symphony from time to time. And what do we think about that? Do you have patients coming in asking you if they should be listening to classical music?
We do. We propose music, but not because it makes you intelligent. I think that was just a myth that was started back, again, I don't remember the specific year, but we can look into that. And that was when, children were exposed to music in utero. Somehow, when they did some testing, they figured out that they were emotionally a bit more advanced than those who didn't. But that was such a small sample, and it just stuck because it's cool and sexy. Mozart effect, pregnant women putting headphones on their bellies and making their, fetuses listen to classical music. But whatever. There are different types of music around the world, and intelligence is such a vague term, and we know that
right. It's very hard to quantify.
There's so many factors that affect it. Again, I mean, it sounds nice, but it's not really based on any hard evidence. But as far as music is concerned, it's such a beautiful therapeutic way of relieving anxiety. One of the things that I see and treat more often than memory problems in Alzheimer's patients is anxiety. The fear of not being able to do things just imagine. You're this, independent person living your life, and then suddenly you just have to rely on someone who you may or may not like for everything. That's awful. Imagine the stress and the anxiety that people go through, right?
Yeah, it's scary.
So we treat anxiety, and music seems to be just the most amazing therapy for anxiety. For people who may have had some history of playing a musical instrument or singing or being involved in music, bringing that back into their life kind of gives them an avenue, not necessarily to distract themselves, but also it's one of those activities that improves your cognitive resilience overall. There have been studies by Yakov Stern at Columbia, who used to be my mentor. He's the guy who really coined the term cognitive reserve and resilience. And we know that when people engage with activities like, learning a new musical instrument or singing or just getting involved in something that involves your frontal lobe and your parietal lobe, you listen to it, your emotions are involved. It's so therapeutic. And they've done studies in functional MRI studies where when somebody's listening to music or playing music, their brain is on fire. So it's a wonderful way to prevent decline and optimize your cognition to a certain extent, and also an anxiety relief. So we're all into it. And one of the things that goes away last is your capacity for music. So we have patients who were musicians long time ago, right? I mean, this is pretty emotional. One story, we had we had a patient. Dean was the attending. Maybe I should let him say the story, but it's okay. I'll steal his story. I steal his stories all the time because he has better stories than me. But, we were rounding with residents and medical students, and there was this lovely patient with advanced Alzheimer's disease, and she was laying in bed. And one of the residents, when we round with residents, there are multiple residents and students, and somebody just pulled up her chart and said, yeah, this is Mrs. So-and-so. We're going to call her Rosemary. That was her name. So Rosemary was a piano teacher for 55 years. It's like, oh, so that's such a huge aspect of her life. Let's go ahead and kind of use that to get to the patient, right? Because she was not speaking at all. She would just stare off into air, and she was not communicating with anyone. And we're trying to engage with her to see how she was doing. And she had sepsis and infection, and she was under a lot of antibiotics. And there was this steep decline in her cognition, and she was not interacting with anyone. So Dean went close to her. I was like, Rosemary, can you see me? Can you hear me? Good morning. Look, we're here to visit you. Can you look at me? And she's looking straight through him and not really engaging. And he goes, who was a better pianist, Mozart or Beethoven? And she doesn't look, and she's just looking off and straight. And then Dean was just, irritating her. Like, Rosemary, tell me, who's a better pianist? Was it Mozart or Beethoven? And just something happened, and just kind of clicked, right? And she just looked at him and said, what a stupid question. And just, she was like, oh, we're engaged. We're locked in. We talked to her. So we figured out that is an island for us to kind of get through to her. So we had one of the...
Wait, but now I want to know the answer. Who is the better pianist?
We didn't find out. But that was, she just said, what a stupid question. And so we made sure that she was listening to classical music. It was always on. And whenever there was music on, she would be more interactive. She would actually talk to the nurses. She would say no or yes. And that seemed to be like a central hub for her where she related to everything else. And you see musicians who have Alzheimer's disease, they forget everything, but they can still play in a band. They can still go up on a stage and play piano, or they can start singing, which is so fascinating. It lives in a very core area of your brain.
Yeah, I mean, from a neuroanatomical standpoint, the regions of the brain that process memories and the regions of the brain that process music are very close to each other. So it kind of makes sense that they're so intricately related. And our capacity for memory, when it's set to music, is just vastly superior, which is why when a song comes on that you haven't heard for decades, you can still remember every single lyric to it, even if you haven't heard it in so long. It's phenomenal.
It really is. Me too.
Blows me away.
So I'm a musician. I was a trained singer, and I play the piano. And my daughter's and she's being trained in opera singing. She's amazing. She's fascinating. But in any case, when we would drown in the stroke unit, because I'm a vascular neurologist, and there would be patients with aphasia. Aphasia essentially means when you lose the capacity to speak, either understand or produce speech. There are different types of aphasias. Even in aphasic patients, you would go and I would start singing with them. I'd be just like, hey, Jude. And then they would be like, don't be afraid. Mm-hmm. Even though they wouldn't be able to communicate with another individual, music actually resides in a different area of your brain. And you would interact with them and you would actually use that as speech therapy. It's just a fascinating area. We'll talk about aphasia some other time, but it's amazing.
Yeah. And just real quick, I mean, one of my very best friends, she lost her father to brain cancer. And I remember at the very end of his life, I mean, it was very difficult for him, as you said, with aphasia. I mean, we watched him, just gradually decline. And even when he couldn't speak, he would sing. And that was a way for us to keep up the communication. So, Ayesha, we got so many amazing questions from our Heard from the Herd segment. Heard from the Herd. I just want to be mindful of time here. Would it be okay if I pose a bunch of questions and maybe the two of you could weigh in? Not too rapid fire, but I just want to get through some of these questions in an efficient manner. So let's go through if that's okay.
Absolutely.
All right. So let's talk about brain training games. My lay understanding is that brain training games can improve maybe some specific cognitive skills in the short term. I don't know about significant clinical impact in terms of overall cognitive aging. So can we just talk briefly about that?
Yeah, so there is some evidence about even like those silly computer games where you connect dots, right? They've done some studies that show that some brain games can improve some aspects of neuropsychological testing scores, because that's our objective outcome, right? What are we looking at? We're looking at improvement in global cognitive scores. And then there are different domains of cognition, whether it's memory, executive function, speed of processing, so on and so forth. Mm-hmm. And some of these games seem to actually improve speed of processing and certain types of memory. But in the long term, it's more complex real life activities that matter more, that make a huge difference. So like we were talking about learning a new musical instrument, making sure that you're engaged in something that, that is essentially involving multiple domains of cognition, tasks that involve your memory, your executive function, decision-making, processing, those are much better. So, and I'm saying this because again, in the world of misinformation, people are pushing these computer games and phone games, and everybody's on their tablets pressing a button. Yeah, maybe it's going to help, but it's much better to adhere to real life activities.
Right. I mean, I always heard that like playing those games will only make you better like at that game. And it's the best way, like you said, is I would argue that like learning anything, like musical instrument is a great example, but just like learning in general is a great way to kind of like at the cellular level strengthen synaptic connections, which can in turn increase your cognitive reserve. Reading, even like social engagement as well is a huge aspect in that. So if you can do something social, like taking a class with other people, like that too is something, just as an example.
Yes, absolutely. Social connection is a huge thing. So any activities that involves other human beings, because talking to other human beings is not like playing a video game. It requires so much more. So it's more complex, multifaceted, real life activities that, Sarah, that you mentioned are much better.
All right, so I'm going to combine two questions here because I think that they're somewhat similar. We got some questions about, are there certain foods that can cleanse or detoxify the brain? And then but drinking large amounts of water could improve things like cognitive function. So I don't know if there's this idea of cleansing or detoxifying the brain. Can you weigh in on that?
Oh, goodness. I think when I hear the word detox, that's a red flag. Like detox has become a red flag. I don't think it works that way. Like I said earlier,
is your brain dirty? Like, why do you need to clean it?
You have your kidney and your liver, right? They do a good job. So just leave it alone at that. And it can be difficult for people to understand that, because that word is used so ubiquitously on social media, detox this and detox that. And then they have these supplements for detoxification as well, which doesn't make any sense. But with regards to eating something to remove something from your body, doesn't work, right? Your liver and your kidney do a great job at it. But if you, as far as food is concerned, if you eat a diet that consists of fruits and vegetables and whole grains, nuts and seeds and lean proteins and sources of omega-3 fatty acids, you're really giving your body and your brain everything that it requires to function normally. You know what's really important? Calories. Making sure that you get enough calories. People try to vilify sugar and carbohydrates.
Yes.
Are you kidding? Come on. Yeah. Glucose is like the commodity.
We did a whole episode on that.
The brain functions on sugar and on glucose. And so, you have these glucose goddesses of the world who are trying to fearmonger carbohydrates and glucose, and it's just ridiculous. But eating a dietary pattern that consists of, foods that provide you the anti-inflammatories and antioxidants and a variety of them, that's good enough. You really don't need to eat anything to get rid of, byproducts. As far as water is concerned, dehydration causing cognitive issues usually happens in people who are elderly, who are debilitated in some way, where their bodies are not able to function properly if they're dehydrated to that extent. But beyond that, I don't think we have any models where water is essential for cognition. Stay hydrated, I suppose.
Yep, definitely need water.
Yeah, so many of these things start with a seed of truth. Like you're saying, like if someone is severely dehydrated, they could have a altered mental state, right? But then to take that to mean that drinking, a large amount of water is going to be good for your cognition, that's a stretch. You're talking about a deficit, right? Exactly. Dehydration. And actually, Ayesha, I'm sure you would co-sign something that Sarah has said probably on almost all of our episodes, that what's good for your body is good for 100%. Your brain. So really diverse, nutrient-rich diets without vilifying individual foods. Well, in the best way possible, Sarah.
Oh, yeah. Yeah. Signed, stamped, notarized. I'm on board. Yeah, absolutely.
Love it. All right, 2 more questions, and I want to be mindful of everyone's time here. Do we only use 10% of our brain? I hear that a lot.
I love this one.
God.
Which 10%?
Somebody has to ask, like, okay, which 10% are you talking about, right?
10?
Like, which part of the brain? No, it's a myth. You use 100% of your brain, but you sometimes use it at half capacity or 10% capacity, right? So, being conscious and being engaged is completely different than the percentage of brain that you use. So it doesn't work that way, but there are ways to actually build focus and attention. And I think it's just a misnomer and a different way of saying that people don't really pay attention or focus, but that's something that is buildable. And attention and focus is the gateway to memory. We know that when people focus on something, they actually memorize things better. And there are ways that you can strengthen that. And there are things that affect your attention and focus. For example, lack of sleep, lack of physical activities, not having enough calories in your food. Some nutritional deficiencies like B12 deficiency can affect your attention and focus as well. So it's more complicated than the sensationalized one statement.
Right. And I mean, aside from the higher order cognitive processes, I mean, there are whole sections of your brains, like the brainstem, your hindbrain, that are working 100% of the time to keep you alive and keep your organ systems functioning. If that was not there, and that's got to be more than 10% right there, like just that you're not even consciously aware of, that's constantly working. You need that to be working. That's why I'm baffled by this 10% myth. It's like, which 10%? Because you definitely need the brainstem. And then without that, well, then you're not going to be consciously aware of anything. You're not going to be attending to thing or remembering anything. It's wild.
All right. Last question. And we had dozens of people ask about this. The idea that people are either left-brained or right-brained, like, oh, I'm math-oriented versus a more creative, artistic type, people associate this with either being left or right-brained. Is this a thing? What say you, neuroscientists?
I've never seen the differences in any of the neuropsychological testing, or, I look at a dozen brain MRIs and honestly, they both look the same and they function the same way. I don't think there's any truth to that. Sarah would know the biological underpinnings of that concept, where it came from, but no, it doesn't work that way. You know what bothered me? Like, women use their left brain and men use their right brain concepts. Like, are you serious? So no, really? It doesn't work that way. It doesn't work that way.
Try only using half your brain. I mean, some people, it seems as though they do, but I mean, your brain, here's the grain of truth that comes from this, is that your brain is lateralized. I mean, you do have a left and a right hemisphere. And with regard to motor function, right, the left side of your brain controls the motor functions of the right side of your body and vice versa. Like, that is a thing. Yeah. But it does not in any way govern personality traits. Mm-hmm. And I would say, like, if you are right-handed, like, maybe the motor cortices controlling the right side of your body on the left side of your brain might be a little more developed. But again, in no way does that associate with personality traits.
Absolutely. You're absolutely right. That's a very important point. The hemispheres are lateralized, which means that, your hemispheres, they perform dominant function. Like, for example, language resides in the left hemisphere. And when people have a left temporal lobe stroke or parietal lobe stroke, or the motor strip has a stroke, then you lose your language compared to, if it happens on the other side, your visual spatial actually gets affected. So, but beyond that, there's no truth to this statement.
Right. Because your two hemispheres are also connected by something called the corpus callosum, which allows there to be constant communication between the two hemispheres in your brain. And there are certain conditions where that corpus callosum is severed, just, I think, because it's medically necessary. I think usually if there's like very severe epilepsy involved is when that happens. But that's the only instance where you would not have constant crosstalk between the two hemispheres of your brain.
That's true. It happens in some multiple sclerosis patients as well if they have lesions there. So, there's no transfer of information from one hemisphere to other. But yeah.
All right. Well, Ayesha, we just want to thank you so much for sharing your time, your expertise with us. Everyone listening right now should go follow Ayesha and Dean Sherzai on social media. Their handle, sorry, I had a little bit of a brain fart there, is The Brain Docs, right? And I know you're active on Instagram. Is that your primary platform?
It is. Yes. It's where I suppose they're all the same, aren't they now? I don't know. It's Instagram and Facebook. But yes, we're thank you so much. That's very kind of you, Jess. And the goal is to spread awareness about brain health and to essentially fight some of the misinformation and help caregivers and patients with dementia and other brain diseases understand these conditions better, not be scared of them. Because again, my patients are everything to me. And one of the reasons why we started this is because we saw the devastation that misinformation causes in our communities. So thank you for doing everything that you do. And I'm so happy to be connected with you all.
Yeah. Oh my gosh. So
Thanks
grateful.
So much,
So The Brain Docs on social media.
Yes,
the
ma'am.
podcast is Your Brain On. We will link to all of this in show notes. Again, thank you so much.
Jess was on the last episode, Your Brain on Misinformation. We're so grateful to you, Jess. That was an incredible episode. Thank you for coming on. And Sarah, I can't wait to have you on as well.
Oh, wow.
Ooh,
Okay, cool. I'm down.
Exciting stuff. Of course, yeah, sorry. Go on, Sarah.
I was just going to say, personally, as a bench scientist, it's such a privilege for me to be able to speak to a clinician. And I think there needs to be more communication between the more clinical and the more basic science side of things when it comes to researching things like dementia that are so multifaceted. And so I just it's such a it's just so great to be able to talk with you and hash these things out from multiple perspectives.
Oh, it's my pleasure. I completely agree with you. One thing that Jess said in the podcast, she was talking about echo chambers, and that resonated with me deeply. And, I think it's time for us to make these conversations available to other people as well. We need to be the bridge of connecting the world and all the amazing things that are happening in the labs to our communities, and just kind of take space. We need to take space so that people are more familiar with the nuanced language of science and be okay with not knowing everything, and also be okay knowing that there are phenomenal human beings that are doing incredible work, and that that's the human history, right? We will find answers as we move along, and if we do it together in a loving, empathic way, that's the world we all want to live in.
Okay, I am hugging you virtually right now. We have some cool stuff in the works that we can't wait to share with folks. And Ayesha, we'd love you to be a part of that. We'll talk offline about that. To our listeners, thank you so much for all of your support. A reminder that we do have a newsletter on Substack. You can subscribe at theunbiasedscipod.substack.com. Also, just want to give a very quick shout out to our producers and editors behind the scene. We don't mention them enough, but we could not do this without them. Ben Siegel, Jared Breitup, and Sarah Lemieux. Thank you so much. With that, Dr. Scheinman, take us home.
Thanks so much for tuning in, you guys. We hope you learned a thing or two. I certainly did. Please join us next week on the pod, your trusted source for no nonsense, just science.